You're listening to the Mother to Baby podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of four, Chris Stallman.
This episode contains evidence-based information that's current as of the day recorded and may change as more data becomes available. To get the very latest information about this topic or other topics in pregnancy and breastfeeding, please contact a mother-to-baby specialist at 866-626-6847, by text at 855-999-3525, or through our website at MotherToBaby.org. Welcome to another episode of the Mother to Baby podcast. My name is Chris Stallman, and I'm a genetic counselor, a mother of four, and a teratogen information specialist. So what I do is I talk to people, so patients, providers, family members, about exposures that can happen before pregnancy, during pregnancy, while breastfeeding, and in cases of adoption. And an exposure can be anything. So it could be a medication, it could be a vaccine, it could be chemicals at a workplace. And exposures are what we usually talk about on the show. But another question that is commonly asked is, where does information about exposures during pregnancy come from? So today, we have a special guest who is going to talk about pregnancy studies. Dr. Christina Chambers is a past president of MotherToBaby. She is also the program director of MotherToBaby California's affiliate. She is a world-renowned perinatal epidemiologist and a professor of pediatrics and the Herbert Wertheim School of Public Health at the University of California, San Diego. Dr. Chambers is also the lead investigator for Mother-to-Baby pregnancy studies, which is a series of observational studies that examine the effects of medications, vaccines, and diseases during pregnancy. Dr. Chambers, welcome back to the show.
Thank you, Chris.
So let's jump right in. What are pregnancy studies, and how does Mother-to-Baby tie in?
So, broadly speaking, pregnancy studies are ways that we observe or try to follow women who are pregnant, who have or have not had a particular exposure. They may have taken a medication, or they may have had a vaccine, or may have had an infection or a certain type of chronic disease or acute disease. And we follow those women in pregnancy studies to see what the outcome of those pregnancies are, if it's healthy or if they have complications. And then we also follow pregnant women who have not had those exposures, so haven't taken the medication or had the infection and so on, and look at their outcomes. And pregnancy studies is a way of comparing people who have had an exposure versus those who haven't had an exposure to better understand, is there an increased risk, or more importantly and hopefully, can this medication or this vaccine be taken safely in pregnancy? I'll just add to that Mother-to-Baby, the counseling service is an incredibly important part of the pregnancy studies that we do, because the counseling service relies on having information to give pregnant or planning persons or adoptive parents about exposures. And if that information doesn't exist from pregnancy studies like the ones that we do, they are sort of have their hands tied in terms of what information they can provide to that pregnant person or her provider.
I couldn't agree more. As someone, who gets these questions on a daily basis, we would be lost without all of the information that we currently do have. But of course, there's always a need for more. So it's the 25th anniversary of the study program this year. Is that right?
That's exactly right. We started this program in 1998. Wow. As a complementary part of the Mother-to-Baby program in general. And so since 1998, pregnancy studies has been growing, and now we conduct pretty much, I would say, half of the pregnancy studies that are being done for new medications and vaccines in the U.S.
Wow, half of the studies. That is amazing. So why are studies and study participation especially important?
Well, Chris, as you said, people who are planning pregnancy or adoptive parents all have questions about exposures during pregnancy. It would be the rare exception that somebody didn't have an exposure during pregnancy. And so this information is critically important to help those individuals make the best decisions about what they are not exposed to, if they have to take a medication or they need a vaccine, or if they've had an exposure, if there are any risks that are associated with it that maybe they need to do something about. Talk to their provider or plan for special circumstances for a delivery. But if there are data that are available that provide reassurance, then that can be incredibly valuable to a pregnant person or somebody planning pregnancy or an adoptive parent and so on. So these studies help all of us make the best decisions for the health of the mom and the baby. As you well know, for most medications, and particularly new medications and new vaccines and so on, this information isn't readily available as soon as the product is marketed, since women are typically not included when they're pregnant in clinical trials. And so it's incredibly important to have participants who are pregnant who have or have not had the exposure of interest participate in these studies so that we can develop this information.
I'm so glad you mentioned that people who are pregnant are not usually involved in these studies, especially early on, because we get those questions all the time. So thinking about that, what are some of the other challenges of conducting these studies?
Well, one of the major challenges is just the logistics of finding pregnant people who have had the exposure of interest and letting them know about the study so that they can participate. And I would say that's probably the major challenge. And it's not, we are so fortunate to have so many people, including your other guests today, who have participated in these studies, but they first had to find out about it. Somebody had to tell them, to learn about it through social media, or their healthcare provider had to tell them. And then they have to agree to take part in the study and devote not a small amount of time over a couple of years of their lives, an important couple of years of their lives. So I think there are challenges in recruitment, in making sure that we get the word out so that people who might take part in these studies have the opportunity to do so. And that's probably the major one.
World Birth Defects Day is March 3rd, and this year we're shining a light on the importance of pregnancy research globally because, as you said, there's challenges and we need to get the word out and we need this participation in order to get this information. What role do pregnancy studies here in the U.S. play in improving the prevention of birth defects worldwide?
Well, I think, Chris, it's important to know that we really don't think that, if a particular exposure in pregnancy does cause birth defects in some pregnant persons, that it's going to do this, only in the U.S. and not in, UK. So if it's a human teratogen, if it's a medication or exposure that does increase the risk for birth defects, it probably does this anywhere, anybody who takes it or is exposed to it. And so things that are done in the U.S., our pregnancy studies are accepted by the European Medicines Agency. They're used by countries throughout the world and healthcare providers and pregnant people throughout the world to try to get the safest approach for what can be used in pregnancy. And so I think that pregnancy studies play a really important role in the information that they contribute to world knowledge about things that might be harmful in pregnancy, or more importantly, those that are not. So to that end, our studies help inform what other countries do, and obviously we share the information that we generate to our network of mother-to-baby counseling services, but there are dozens of countries throughout the world who also have counseling services. Our sister society, the European Network of Teratology Information Services, uses the data that we generate to counsel their pregnant and planning and adoptive parents as well.
And I gotta say, that's one of the things that I love about MotherToBaby and working with the organizations. And I mean that because, we speak with folks, as you mentioned, in all parts of the world, and what we do can help them, what they do can help us. And I love that collaborative spirit. There might be some subtle differences in populations or, what medications are called, different things in different countries. But I just love that we're all coming to work together for the common goal. What are some of the myths associated with study participation?
Well, Chris, I think probably the things that people bring up the most are concern about confidentiality, and that's true in participating in any study. People who participate in our studies are providing a lot of personal information, and we respect and value that incredibly. And that's one of the only ways and the reason why we can conduct these studies and produce good quality, really informative data is because the people who participate are willing to open up their selves and provide their information about themselves and their child to us. So I think we do everything we can to make sure that our participants feel reassured that their information is held confidential, that no individually identifying information is ever released about the study, and that we hold that responsibility in high regard. So that's a myth that we try to overcome to make sure that our participants feel comfortable in participating. Maybe another one, and this would it's just a matter of explaining carefully up front, is sometimes people think that by using the term research, that it means that an intervention is involved.
Right.
So, for example, if you participate in a clinical trial, usually the situation is that you receive a new intervention, a drug or a vaccine or whatever, or you might get a placebo, but there's something actually being done different to you to see how it works or how it affects you. And our studies are not interventional. So we do not, give any medications or recommend any treatments. The only thing that we do is ask the mom to let us have access to, and for her to provide us information about what's happening in her pregnancy and what happens with her child as it would proceed anyway. So that would be one other myth. And then I don't know if this is a myth, but I mentioned earlier that we basically, if a person enrolls early in pregnancy, we're going to be talking to that person several times over 2 years. So we'll talk to them 3 times in pregnancy, after the baby's born, and up to at least a year of that baby's life. So it is a long-term commitment, and we really respect and value the fact that our participants are willing to commit that time. But it's not a lot of time in at any particular window. So an interview when a person enrolls might be an hour, but subsequent interviews might be 10 or 15 minutes. So in the scheme of things, the myth might be this is a huge amount of time in a busy mom's life, who's pregnant and might have other children and so on.
Right.
Is probably might be working. So pregnancy studies very much takes all of that into consideration and tries to work with the participant during pregnancy and postpartum to make sure that those interviews or whatever else she's being asked to do can be worked around when she's available and when it's most convenient for her to complete these things. So I think all in all, even though several hours are required over the course of the 2 years, the payoff at the end in terms of what tremendous value that information can provide to the world and to future pregnant people, I think is really important to understand.
Such a good thing to put in perspective, because if you said to me, I need a couple of hours, I'm like, in one day, I can't possibly do that. But over a longer period of time, as you said, it's a long time, but it's not a lot of time all at once. That makes a lot more sense.
Right.
Before we let you go, I'd like to know, what is your hope for the future of pregnancy studies?
Well, I'm so glad you asked. I think the future of pregnancy research should be that there is a certainly U.S.-wide but global commitment to not building this one brick at a time, but building a house that actually does this research on a consistent, regular, systematic basis for every product, for everything that people have questions about, so that mother-to-baby counselors aren't ever sitting on the phone saying, gee, we really just don't know anything about this drug in human pregnancy, that we are in a much better position of being able to say, we do know something about this in pregnancy because we put the effort, resources, and time as a population into gathering this information in a responsible and sound fashion. So that's what I would like to see, that it becomes a priority, that we do this and we do it large.
Wow, I'm so glad that we have folks like you who are thinking about this enormously large picture, because I am interested and excited about everything you just said, and I can't say I would have come up with that idea. So thank you. Thank you for all that. And Dr. Chambers, thank you again for being on the show. I know you've been on before. We're always so happy to have you on, and especially today talking about such an important topic, especially because of World Birth Defects Day coming up on March 3rd. So thank you. So now that we've had Dr. Chambers share her hopes for the future of pregnancy studies, I am very excited to hear about someone from a past study, a participant who is on the phone willing to share what exactly their experience was like firsthand. We're so happy to welcome Leslie to the show.
Oh, thank you for having me.
My pleasure, Leslie. Where are you calling in from today?
I'm calling from Delaware.
Awesome. Okay. So can you tell us, how did you learn about Mother-to-Baby, our services and the studies?
When I got pregnant and talked to my rheumatologist, she mentioned to me that it would be great if I joined a Mother-to-Baby study and gave me a brochure.
Awesome. Okay. So let's talk a little bit about that if we can. So for you, why was getting evidence-based information about medication during pregnancy so important to you?
Yeah, I'm glad you asked. So I've had inflammatory arthritis, rheumatoid arthritis, since I was 19 years old. And early in my journey with arthritis, several rheumatologists had said, well, you wouldn't be able to get pregnant or take medication while you were pregnant because it would be too dangerous. And, thankfully, more than 10 years later, my doctor said, we have disease under control. I think you could get pregnant. And we carefully planned what medication I would take. But she said, there's so much medication I'd like to give you, but we don't know about it. I wish you would join a study. And, the fact that, like we learned from Dr. Chambers, there's a lot of medication we still don't have data on for people to make decisions about. The chance to contribute so someone else wouldn't have to say, well, I guess I'll have to quit taking the medication that works for me because we don't know if it's safe. That really felt like a great opportunity to contribute to other mothers in the future.
And I just want to stop right here and thank you for that, because we get that all the time. People will call or contact us and ask, and sometimes we don't have any information, certainly, as you well know. And they'd say, well, how do we get information? Is there a way that I can help? So it sounds like you wanted to participate not only for your own benefit, but the benefit of other people who might be taking the same medication or have the same condition.
Right. And Mother2Baby does so many studies on like autoimmune diseases and things that affect women primarily during the childbearing years. Mm-hmm. I mean, they're researching a lot of different medications. I've noticed that they have a lot of studies about conditions that really affect pregnant people during that time of their lives.
Absolutely. And Leslie, we're actually going to stop here, but I want to thank you for letting us know more about you and why you wanted to participate, and ask if you want to come back for the next episode so we can talk to you about what your experience was like, how much time it took, and what other people who are pregnant should know if they want to join a study. So will you join us again for a future episode?
Absolutely. I'd love to.
Great. Thank you. And that'll do it for this episode of the Mother2Baby podcast. As always, thank you so much for listening. And if you have an idea about the podcast, or if you want to participate and be on the podcast, let us know. Send us an email at contactus@mothertobaby.org. Don't forget to subscribe to the podcast. That way you never miss a new episode. And you can also go back and listen to older episodes as well. You can find us on Spotify, iTunes, or however you listen to podcasts. And don't forget, MotherToBaby is here to help you with your questions before and during pregnancy, also for breastfeeding or in cases of adoption. You can reach us by phone at 866-626-6847. You can reach us by text at 855-999-3525. You can visit our website at MotherToBaby.org, where you can find our podcast, but also information on how to live chat with us and our fact sheets and lots of other helpful information. So until next time, thank you, and remember, MotherToBaby is here for you. Take care.
MotherToBaby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Service Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about MotherToBaby, please visit MotherToBaby.org.